Good morning and thank you for joining us on TVC News once again. The Vice President Kashim Shettima has emphasized President Tinubu's commitment to good governance. The Vice President says the renewed hope agenda is a transformative policy aimed at repositioning Nigeria as a prime global investment destination. He was speaking during a dialogue on Nigeria's global ambitions, where he also highlighted President Tinubu's intervention in the economy. And on security challenges, the Vice President has affirmed the administration's commitment to guaranteeing the safety of lives and properties through regional and national interventions.
Our goal is to start counting our wins in a few months from now. And this is only possible when we all come together to ensure a sustainable progression. While this is the take-up of the implementation phase of Nigeria's HCD program under this next dispensation, I am convinced that this high-powered steering committee will go to any length to ensure that the program is the success we all desire. Our human capital remains our greatest asset.
The Vice President should be commended for the first time trying to identify all the critical stakeholders, not only the National Assembly, but involving the subnationals as well into this particular steering committee. So it makes it easier for us to do our bit. The executive will do its own bit, the states will do their own bit. The committee has not actually sat down to agree on what percentage we need to be achieving year in, year out.
And to Benue State, where the government has promised to improve security, healthcare and water supply in all internally displaced persons camps across the state. The Commissioner for Humanitarian and Disaster Management, Andowase Kunde, says this during the Durable Solutions Framework Development and Action Planning Workshop for IDPs. Maya Wakwata reports.
The chairman of the government, that's interesting.
Aside from being dislodged from their indigenous home, there is need for internally displaced persons to enjoy basic humanitarian needs. Having over 2 million internally displaced persons, Benue State government is carrying out a workshop to create a durable solution, framework development and action plan to sustain and eventually return these displaced persons to their ancestral home. The Commissioner for Humanitarian and Disaster Management, who is also the chairman of the task force on durable solution to the return of internally displaced persons, notes that a survey has already been carried out to commence provision of humanitarian needs.
Yeah, the essence of this program today is to bring those representatives from the IDPs. We want to return them. And what we want to do is we want to do a workable humanitarian state action plan. And it means that those who want to work for them, they will first of all tell us what they want.
The UNDP representative on durable solution in Benue State commended the efforts of the Governor Alia-led administration in improving the condition of IDPs in the state. He assures that donor bodies like UNDP, IOM, and other civil society organizations will always stand with the Benue State government to resettle the displaced.
Here in Benue State to help resolve, to have a long-term resolution to the internal displacement crisis here. We've been working on that for a while and gathering data. We don't want them to be left behind, so their presence is of utmost importance. That's why we're bringing them here to hear what they have to say, to put it down and to obviously find a permanent resolution to the crisis in Benue State.
Some of the IDPs who spoke at the workshop listed lack of security, water, healthcare facilities, schools, food, bridges and markets are some of the challenges facing them. Mayowa Okwato, TVC News, Makodi.
And to Osun State, where the government says a thorough and due process has been followed in the recruitment of teachers into public primary and secondary schools. The chairman of Osun State Universal Basic Education Board, Ibukun Fadipe, stated this at the distribution of thousands of exercise books held in Ile-Ife. Rafiu Hamid has details.
The 30,000 exercise books and other writing materials were provided by Senator Francis Fadamsi to support the pupils in the Osun East Senatorial District. The senator believes the development of education should not be left to government alone, hence the need for this gesture.
The population is on the rise. It's seriously on the rise. But the resources available is grossly inadequate to cater for our children. That is why we need government-private partnership to promote education in this country. The government is trying their best, but then their best is not enough.
The student, the movement in their education is what we need now, at least to be helping others. Dividend of democracy from the government, from the senator, likewise from the government. If everybody is trying to do little things like this, it will help the pupils.
Both the teachers and their pupils describe the gesture as laudable.
Because what they did now, the children will be given the book and they will be using it. Because most of the children, they don't have book. Most of them, they come from the poor family that cannot afford to eat daily food, even of talk less of buying textbook, writing materials.
We are all happy that the senator could do something big like this for us. He gave us big notes of different size, 60 leaves, 20 leaves, and 40 leaves with different kind of pen, and we are also happy.
The state government used the opportunity to give update on the ongoing teachers recruitment exercise.
We are following the due process because we have conducted the exam for them, and we are still going to conduct an interview for them. After the interview, we select the best of the best from them. So we will know who is who with the interview physically that can teach our children very, very well.
We want people of like minds to come together, most especially stakeholders in the education sector, to make sure they come to our aid in education in Osun State. This is part of it. This is learning materials. The students that are having this one now, they will be happy, and the parents will be happy as well.
The senator had last week distributed food items to his constituents. Rafiu Hamid, TVC News, Ile-Ife, Osun State.
And in Delta State, the government believes its 10% malaria burden can be reduced further when organizations and well-meaning individuals join in the fight against the deadly disease. Commissioner for Health, Joseph Onajeme, stated this during the free malaria training in Warri. Ikenamichi has details.
Marching through major streets in Warri, the group, together with health workers from the State Ministry of Health, sensitized residents on the need to adopt preventive measures against malaria. Though this year's World Malaria Day has been observed in April 25th, but the theme, Accelerating Fight Against Malaria for a More Equitable World, is quite apt for these free malaria treatments.
Malaria is deadly. Malaria can be prevented and it can be treated. So they should try and clean up their environment, sleep inside their mosquito nets, their mosquito treated bed nets that have been given to them. And then when they find themselves with all those, any of those symptoms or all those symptoms that we have mentioned during the lecture, headache, fever, body pain, joint pain, they should go to the health facilities for proper diagnosis and treatment.
They should not just look at malaria. It's just malaria. It is common, but it's very, very deadly. People do not believe that malaria kills, but it does kill. So instead of going to all these native people taking agbo that does not seem to work for most of them, they should get proper checkup and take proper treatment for it.
Over 500 residents of Warri converge here to receive free malaria treatment and mosquito-treated nets as medical practitioners underscore the impact of this gesture.
The percentage that we got in 2021 dropped to 10%. That is to tell you that there is a stride in the fight against what? Malaria. So our major aim of coming to this place, Warri South precisely, is to eliminate malaria to the zero level.
Generally, we give them education on how to avoid stagnant water, bushes around their houses, then blocked drains. That's what we have been doing.
Some of the symptoms of malaria include high fever, headache, sweating, diarrhea, fatigue, muscle and back pain, nausea, and vomiting. The health workers also advised against self-medication. Ikenna Amechi, TVC News, Warri.
Now, after months of complaints on the stringent requirement to obtain certificate verification due to the revised guidelines by the Nursing and Midwifery Council of Nigeria, the nursing group administrators is re-emphasizing the need to dialogue with key players for a more equitable and inclusive process. Zainab Akonde has details in this report.
The issue surrounding the verification guideline came into limelight in February 2024 when nurses under the National Association of Nigerian Nurses and Midwives embarked on a protest and threatened to shut down the health sector. This protest was sparked by the Nursing and Midwifery Council of Nigeria after a circular was issued to revise the guidelines for certificate verification across the country. 3 months after this protest, the story remains the same. Disturbed by this, the nursing group administrators in Lagos State is calling for the reversal of the verification guidelines.
We demand an immediate withdrawal of the nursing verification rules by the Nursing and Midwifery Council of Nigeria, taking into account the concerns raised by nursing professionals, healthcare stakeholders, and the general public.
We are asking NAM to liaise with the Nursing and Midwifery Council of Nigeria, let them withdraw that new guideline so that the aggrieved nurses that went to court can withdraw the case.
For nurses who are interested in pursuing international certifications, they believe the implementation of the policy is an infringement on their rights and career aspirations.
I feel like it is like a bondage for nurses. It's not a free will. It's not a freedom for everybody. Why will I graduate as a nursing student and I won't be able to participate in other activities? Like, what if I want to become a travel nurse?
Lately, I've been very discouraged to practice in Nigeria, and seeing this guideline is more discouraging. I feel it's going to really frustrate young nurses, student nurses that wants to, travel out or practice outside the country.
The nurses also want the council to address the welfare of nurses in the country. This, they say, will improve healthcare delivery and address the brain drain in the sector.
Competitive remuneration and compensation packages for nurses, which should include upward review of the retention allowance, upward review of hazard allowance, and the payment of a hardship allowance that accounts for the increased caseload.
As the nursing group administrators look forward to a more effective certificate verification process, they also hope for a future where nurses' welfare will be prioritized. Zainab Akonde, TVC News, Lagos.